The growing concern over the inflammatory syndrome possibly linked to COVID-19 that's hitting children. Sadly, more young lives lost. ABC's Stephanie Ramos joins us now from Lenox Hill Hospital in New York City with more on these troubling developments. Stephanie, good morning.
Whit, good morning. New York's governor says a teenager is the latest to fall victim to this rare inflammatory syndrome that typically affects toddler to elementary school age kids. They're showing symptoms similar to Kawasaki disease and toxic shock syndrome. And doctors say those symptoms don't appear until weeks after exposure to COVID-19. This morning, the mysterious syndrome linked to coronavirus has now taken the lives of 3 children in New York.
We were laboring under the impression that young people were not affected by COVID-19. We're not so sure that that is the fact anymore.
In New York State, more than 73 children have been affected by the rare illness called Pediatric multisystem inflammatory syndrome. There are cases in at least 6 other states. Doctors believe the syndrome is emerging in young children who may have been infected with COVID-19.
Now, these are children who come in who don't present the symptoms that we normally are familiar with COVID. It's not a respiratory illness.
Doctors say symptoms for the rare syndrome include persistent fever, rash, and abdominal symptoms. It has features similar to Kawasaki disease, which causes the inflammation of blood vessels and can lead to heart problems. In Michigan, for days, this 9-year-old girl had a fever and red, irritated eyes. Days later, she started slipping into cardiac arrest. The doctor treating her says she tested positive for COVID-19 and Kawasaki.
So she is going to need to be off the those vasopressors I mentioned that are helping her heart. After she's going to stay on aspirin for actually 6 to 8 weeks.
In New York, 8-year-old Jayden Hardiwar had a mild fever before becoming critically ill. He's finally off of a ventilator and expected to be discharged from the hospital today after going into cardiac arrest last week. He, however, tested negative for COVID-19 and positive for antibodies.
He's conscious, he's listening to us, but his voice is not there yet. He's not able to say much.
Doctors say this is a rare condition and can be treated, but parents need to be alert to the symptoms. Here in New York, the Department of Health says they are now working with the CDC to develop a national criteria for identifying and responding to this syndrome. Eva.
Well, Stephanie Ramos, thank you. And our chief medical correspondent, Dr. Jen Aston, joins us this morning. Hearing about these cases in children, it's scary. How rare is this, and what should parents know?
Well, it is scary, Eva, but in medicine and science, we really have to remember the numbers. And right now, luckily, this is rare. But again, if it happens to your child, 1 is all it takes. I think that this is an evolving situation. Pediatricians are asking for assistance from their colleagues in rheumatology, immunology, infectious diseases, cardiology, and they're still in the observation stage, and they're just treating these children who have this hyperinflammatory shock really right now based on symptoms because the cause is still unknown.
Going back to those cases in the White House with those new COVID positive results, what should they be doing?
Well, listen, first of all, the CDC guidelines are just that. They are guidelines and they are meant to be individualized. It's not a one-size-fits-all approach. But if you have close contact, which is defined as less than approximately 6 feet with a confirmed case in certain groups of people, the recommendation is self-quarantine for 14 days since the last exposure to that person. That means act as if you are exposed, Eva, meaning no one coming in and out of your home, mask on, keeping at least 6 feet of distance from anyone in your home environment. Because again, it's not about me, it's about we and protecting those around you. That observation period right now is 14 days.
Now, as for COVID-19 itself, what can you tell us about this new study on a 3-drug treatment that we are hearing about?
This was interesting. Phase 2 trials, it was reported in The Lancet. They compared a cocktail of 3 antiviral drugs. 2 were in pill form, 1 was in injection form. In patients with mild or moderate COVID-19, they did see that the patients in this three-drug cocktail arm of the trial resolved their symptoms a little faster, stopped shedding virus sooner. Again, these were mild to moderate cases, not severe cases, but it indicates preliminarily that there may be a better synergy when 3 drugs work together, much like people, than when one of these drugs works by themselves. So still needing more research, but definitely some encouraging results.
Some positive news to hear this morning. Thank you, Dr. Jen Ashton, as always.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.